From This Corner with John Ball is brought to you by KNEO 91.7 FM, The Word.
Good morning, this is From This Corner, and I'm your host, John Ball, and we love opportunities to talk about Southwest Missouri, and we love even more opportunities to talk about things that improve Southwest Missouri. And in this case, we have Dr. Justin Dillingham. Dr. Dillingham is going to be a full-time doctor in the Freeman Clinic in Anderson, Missouri, which, by the way, is just right across the street from the football field, right?
Just about. A little bit down the road, but yeah.
Well, Dr. Dillingham, tell us a little bit about you.
Well, I'm Justin Dillingham. I am a family doctor. Grew up in Haskell, Oklahoma, a small town south of Tulsa. And I've lived in Joplin for the past 7 years, but recently moved down to the Anderson Clinic. And I've already started there, been there for about 3 weeks, and I'm loving it. I'm a small town person and already feel like I've went back to my roots.
Well, you're one of those guys that's kind of a jack of all trades. You were telling me a little while ago that you actually got someone who unfortunately got their hand stuck into a saw, and you had to be able to stitch them up and then send them on their way, right?
Yeah, that's not typical type stuff we'd recommend come to the clinic, but if you've got a problem and you can't make it anywhere else, we will do our best to help you out with whatever you got. That's kind of what family medicine is we do a little bit of everything.
All right, well, right now you kind of live in the Joplin area. How long does it take you to get to Anderson?
About 30 minutes.
About 30 minutes. You have family?
Yep. Yeah, I've got a wife and 3 boys, all 8, 6, and 3. So they keep us busy when we're at home, for sure.
Well, here's the best part about that. When they get ready to get married, you just got to pay for the food.
That's true. That's true.
So that's great. How many other people work with you at the clinic?
We've got 4 main staff, a clinic manager, and there's a nurse practitioner there that helps us see a lot of patients. And she's been there a long time and does great work.
Now, up until this time, when you came in, you add so much more because you are full-time. You're there 8 to 5, 8 to 6, maybe whatever it's going to take. And McDonald County, as I know, being down there quite a bit, is a pretty expanded area. So folks have really got a good place to be able to come to Freeman and be serviced centrally there in Anderson.
Yeah, and like I said, we'd be happy to see anything. And if we can't help you, we will help you get to the place that can.
Okay, well, that's great. And one of the things I immediately thought about was the sporting events. We have sporting events over in Anderson, and we're excited about the football program, basketball program, and Doug Ashton is the Freeman trainer for McDonald County. Freeman graciously provides trainers for almost every school that we at KNEO have on our sports network, and it'd be real easy if something happens just to run across the street where there's a clinic. There's all kinds of things to do, and if necessary, get them on up to Joplin quickly. Yeah,
we would be happy to, like I said, anything that comes in, we will do our best to help out with.
Are you starting to develop a little bit of a clientele, or people are seeing that you're there and are kind of anxious to get there?
Yeah, the first week was the snowy week, so it was a little slower then just because people don't want to get out, understandably. But by week 2, already seeing a lot of the sports physicals, getting ready for the season, and just a wide mix already.
You know, it kind of reminds me of the old Andy Griffith days when a new young doctor comes into town, and Barney went to see the doctor. He kind of caught him with kind of a critical eye to see if the doctor knew what he was talking about, and the doctor had him do things that he wouldn't have otherwise had him do. But before all was said and done, if the doctor hadn't caught him, Barney could have been in real trouble.
Yeah.
So those are the kind of things that you're doing. You're trying to avert real disaster.
Yeah.
You're trying to get people taken care of on a regular basis. And even though McDonald County is spread out, if they'll take the time to spend in the 20 to 30 minutes to get there, you can help them or get them to the next level.
Absolutely. And I would encourage people, even if you don't have anything wrong, if you haven't seen a doctor in a long time, it might be a good idea to come in for a physical, because sometimes there's stuff that don't have symptoms. If your cholesterol's high, if your blood pressure's high, if we get that under control as early as possible.
Well, let's stop at diabetes, okay? We're not going to talk about that.
Diabetes is a big subject, but I like to try to make that as approachable as possible. I said, if you look at something as too big and too hard to control, a lot of people, it's just human mentality. We kind of want to give up on it, or I'll do something on that later when it's worse. But we like to take little bite-sized chunks out of stuff.
Well,
like that.
I am assuming that you are probably taking a holistic approach to taking care of the whole body. Mm-hmm. And diabetes is one of those things, if you don't get on it, and you don't get on it fast, and you get a regimen down, it can really be disastrous to your whole health system.
Absolutely. And a big problem with diabetes is in the early phases, your sugars run a little high. You don't really feel bad. So again, you'll wait years until it has caused that damage that's irreversible. So we'd like to help anyone from the earliest phase. I always tell people too, you're the ultimate boss. I'm not going to make you take anything or do anything. I'm here to advise you and help you be as healthy as you can be with what you're comfortable with. So if you don't like the idea of a certain medicine, we'll work with you to try to still help you as much as possible.
Speaking of being healthy, you've kind of got your own little testimony as far as weight control is concerned and things like that. We'd love to hear that.
Well, I have always been overweight since, probably grade school. I probably crossed 200 pounds in early middle school and didn't cross under 200 for many, many years. I topped out at about 320 pounds during med school, and I had that same mentality. I didn't feel terrible, so I was just going to put it off and do better tomorrow, or tomorrow never comes. So tomorrow becomes next week, becomes next year. And then just finally, when I was practicing in Joplin, decided I needed to be a better example for people, and I knew I needed to be healthier too. And slowly over time have gotten the weight down. I'm still not at goal weight. I'm human, and humans, we tend to mess up. So I'm up and down, but I'm always working towards that ultimate goal of being as healthy as I can be. And people tend to respond to that. So if you've got any weight concerns, I will work with you as hard as possible to try to get you on track.
Well, thank you. We really appreciate that. Once again, this is From This Corner, and we're talking with Dr. Justin Dillingham. Dr. Dillingham has moved his practice to Anderson, Missouri. He's in the clinic right across the street from the high school and is inviting everybody to come in and see him. There's 4 people in his office. There's a nurse practitioner, and up to this point, they've not been able to see a whole lot, but Freeman, once again, is doing everything they can to make Southwest Missouri a better place. Yeah. And we want people to take advantage of that. Your hours, once again, are 8 to 6, 5, whatever it needs to be.
Yep.
Have you got a phone number for us to call?
I do not know the number offhand.
Okay, well, we will get that, and we'll put that on the end of this. This will be From This Corner, and it'll be aired on our radio station on one of the Thursdays here in the future. But more importantly, it'll be a link to YouTube that you can see us live. There's someone going to tell us what the number is.
Our number is 417-845-0545.
All right, thank you so very much. Hit it one more time.
417-845-0545.
All right, and we want to encourage anybody who does not, because your body's all you got.
That's right.
If you don't take care of your body, all of the other nasty, ugly things that you can think of come about. So come and see Dr. Dillingham. He'd love to see you. Doc, thanks so much for being here. I know you've got a trip of about 20 minutes to get down to your clinic and get things started, so we appreciate you taking time out of your day.
Well, thank you so much for having me.
You bet.
From This Corner with John Ball has been brought to you by KNEO 91.7 FM, The Word. You can watch this episode and many previous episodes of From This Corner on our YouTube channel. Link to our website at www.kneo.org.